Be the boss of who you are. You take back control and you set your own priorities. And you're struggling with a problem. There's no question about it. Drugs are like a bully that's pushing you around. And if you let yourself get pushed around, you will be.
Dr. Spiegel, welcome to the show. Now, you seem to be on a bit of a mission here in getting the word out about clinical hypnosis. If I look around different YouTube channels and podcasts, you're everywhere. So I'm just curious, why is this so important that the word gets out about this form of treatment?
Niall, hypnosis is the oldest Western conception of a psychotherapy. It's the first time a talking interaction between a doctor and a patient was thought to have therapeutic benefit. It's a powerful tool. The risk-benefit ratio is so much better than many of the other treatments that we use to treat addictions and other problems, stress, pain, insomnia, that I am pretty frustrated at this part of my career that the uptake has been so slow. And so what I want to do is, we've been working for years now on this new digital interactive hypnosis app called Reveri, where patients can hear my mellifluous voice. I ask questions. Depending on their answer, they get a different direction so that it's interactive and customized to each patient. And I want to make that available to people. I can't do it all face-to-face anymore. I've used hypnosis with about 7,000 people in my career, but I want to reach a lot more people than that. And I want to help doctors and psychologists and others who are helping patients with an added tool that they can refer their patients to help them better manage their own impulses to take drugs.
I used the app for the first time this week. I used the sleep hypnosis and I was out like that. It was crazy.
Is that right?
It was just like, it was so effective. It was so
That's
effective.
Great.
It caught me off guard, actually, to be honest. Now, have you thought about what the world could look like if everybody had access to Reveri and was doing self-hypnosis? What kind of difference could this make in our society?
That's a wonderful question. I think, the biggest fear people have about hypnosis is that they're losing control. It's actually a way of enhancing control. So just like I love your moment of surprise where you were open enough to try it, and I'll be darned, it worked, and you were surprised at how much it worked. That's the thing that both intrigues me and frustrates me, that there's an opportunity right there inside your brain that you didn't know you could use until you tried Reveri. And so it's like, it's like an unopened gift. It's there, but you're not sure because you haven't tried it yet. And once you have, I hope that will change you and that you'll get much more benefit from it. So my hope is that people who are treating people with addictions and related problems like stress, anxiety, insomnia, will help the people they work with discover this undiscovered ability that so many people have.
I don't want to assume that everybody, whenever we speak about hypnosis, that everyone just knows what we're talking about. So Could you maybe tell us about the three key elements of clinical hypnosis and how it differs from stage hypnosis?
Yes, sure. So the three key elements are absorption, dissociation, and cognitive flexibility. So the first part, the absorption, is the capacity to narrow the focus of attention. It's like looking through the telephoto lens of a camera. What you see with great detail, but you're less aware of what's in the surroundings. So it's an intense kind of focus that can be very useful in trying something from a different point of view. The dissociation, to do that, you need to put outside of conscious awareness things that are ordinarily in consciousness. Now, we do that all the time. You're having sensations touching the chair you're sitting in, but hopefully you weren't aware of that till I brought it to your attention. If you were, we can stop now. It's a necessary part of focused attention. But it also means you can put aside things that often get in your way. I've never tried doing this before. What if I let go of the things I've depended on all my life? People expect me to be a certain way. If you can silence those voices in your head, you're much freer to try out being a different person. So rather than arguing yourself into change from the top, you do it from the bottom up by saying, what does it feel like to be different, to do something different? Because you're putting aside your usual assumptions about yourself. And the third part is cognitive flexibility. you're more willing and open to try out a different way of thinking about something than you ordinarily would be. That used to be called suggestibility, which scares people. You know, you will do everything I say. You know, that's not what hypnosis is about. So if you have those three components mobilized, you're in a much better position to make a rapid change and see what it feels like.
I read online somewhere that you've done a lot of work and research with dissociative identity disorder. Is that right?
Yes, I have. Yeah.
I'm just curious to ask, has that doing that work impacted your view on human nature at all?
Well, it has, Niall. Typically, people with dissociative identity disorder are highly hypnotizable. And the interesting thing is that that ability is actually very useful as a therapeutic tool. I can help them learn how to change from one identity state to another and begin to integrate. So the goal is not getting rid of the unpleasant identities. It's understanding the reason for it, that trauma often leads to dissociation. People who suffer terrible trauma, particularly early in life, use it as a protective resource. I had one patient with DID who, when her father would rape her as a girl, she said, I would just go to a mountain meadow full of wildflowers. And if you think about it, if you have no choice, if you're being made into an object of sexual exploitation as a girl, it's far better to just leave your body there and go somewhere else. And so it's a protective defense, but it also creates its own set of problems. And hypnosis is very helpful in that I can help them bridge the gap between what they consciously recall at any given moment and these other parts of their experience that they need to come to terms with in order to live better.
You've co-authored a book with your father, I think, called Trance and Treatment. And I think
that's correct.
The "and" is a significant word here. So when we think hypnosis, we might just think the trance state, but there's two separate elements here. Could you maybe tell us a bit more about that?
That's exactly right. And it is trance and treatment. When my late father and I wrote the book, we thought about that title very carefully, because what we do, it's not just hypnosis per se, but it's the way we use hypnosis. So we see it not as something we do to a patient, but as a tool they use for themselves. And we tailor the choice of how we use hypnosis, both to their cognitive style, to their hypnotizability, and also to just things that generally work better in general, but particularly with hypnosis. So for example, we tend to focus in the choice of treatment on what people are for, not what they're against. If I tell you, don't think about purple elephants, what are you thinking about? Or a lot of the stop smoking campaigns used to be, I'd see signs on the highway, are you dying for a cigarette? Very clever. People would think, yes, I am. And they light up. That doesn't work. What we do is help people focus on what they're for, respecting and protecting their body, thinking of their body as if it were a child or an infant that had to take into it anything you put into it. So you can make the decision to protect your body from things that damage it and instantly feel good about yourself. Not that you're depriving yourself of something, but that you're going to be a better person because you're taking this stance of respecting and protecting your body. So the way we use hypnosis is to identify the hypnotizability as an asset you can mobilize to change quickly, and use it in conjunction with a treatment approach that helps you restructure the way you deal with the problem.
This idea that maybe hypnosis can be thought of as a form of exposure therapy taken inside. So in some sense, we're able to go to really difficult places in a hypnotic state and face them and be okay with them and recover better that way, as opposed to just pushing it all away. Am I in the right ballpark here? Or
you are in the right ballpark. The issue here is that in hypnosis, because hypnosis is such a shift, that feeling of surprise you had, my God, I really just fell asleep. It's when you shift states and go into this state, it is different. And that provides a kind of containment for it. So I'm dealing with this when I'm in hypnosis, and the implication is when I'm done with the hypnosis, I can kind of put it aside and go back to my usual way of being. So, many people are worried about thinking about trauma, for example, because they think, oh my God, I opened Pandora's box and I'll never close it. I'll never be able to get away from it. When I treat people for traumatic stress, and this is not something that we do in Reveri, which is more a health and welfare learning experience, I help them control their exposure to the stress. So, for example, I was treating a woman who had suffered an attempted sexual assault, and she had struggled with the guy who tried to drag her upstairs into her apartment. She wasn't actually raped, but she was beaten badly and wound up with a basilar skull fracture. And so she was trying to remember what his face looked like, and it was getting dark. She couldn't really see him. So she was very hypnotizable. I had her, first of all, make her body feel comfortable. So she was floating in a bath, a lake, a hot tub, or floating in space. She was safe. Nothing would happen to her body. And then I said, picture the guy and picture what's happening. And she said, she was getting emotional. She said, you know what? He doesn't just want to rape me. He wants to kill me. If he gets me upstairs, he's going to kill me. So the actual memory was even worse than what she had recalled. And then I said, now picture on the other side of the screen what you did to protect yourself. And she said, you know what? He's surprised that I'm fighting that hard. He didn't think I would. So she came out of it. I said, you're safe now. What sense do you make of this? And because on one hand, it was worse than she thought it was. On the other hand, she had been feeling guilty about getting herself hurt. She was thinking, maybe I shouldn't have fought. And she realized that she'd probably saved her life. So she came out of it with a different point of view. It was a horrible thing, but she'd done something that may well have saved her life. So she felt less guilty about the way she spontaneously reacted to the assault. And that's what you can help people do, is restructure their point of view about what the trauma was.
Have you thought much about any parallels between hypnosis and EMDR?
I have. I think, if you think about, the old image of a hypnotist, dangling a watch and all that, that's kind of what you do with EMDR, if your eyes were going back and forth. I think there's a lot that is sort of, unconsciously but spontaneously hypnotic about the EMDR approach. And I do think some people get better, and there's a lot of sort of exposure therapy in it that you're asked to rethink the trauma. But the actual use of these hive movements, I don't think has much to do with the therapeutic benefit. In studies that have been done, separating the components of the EMDR show that, yes, the therapy can be helpful, but that if you take out the eye movement part of it, it doesn't change the result very much. And in fact, Francine Shapiro, she's gone now, but she, later in her career, she had thought a great deal about this sort of left-right movement and how important it was. She tried now doing tapping on other sides and other things. And I think that's the part of it that is less specific than people think it is.
I actually interviewed a lady last week, Dr. Laurel Parnell, and she's really continued on Shapiro's work. And one of the things that she was saying about, maybe she's not saying it's definitely the case, but one of the reasons why they think EMDR and tapping might work is because you might be facilitating communication between the left and right hemispheres, and there's a lot of trauma stored in the right hemisphere, and maybe that's what's going on. Well,
certainly there is some evidence that part of how people relive trauma is visual memories, but there's Bessel van der Kolk's book, The Body Keeps the Score. It's more than just visual, and we have there is some tendency for us to store more visual memories in the right hemisphere, but somatic memories are on both sides, and it may well be, but I'd say it's a theory. It's not proven that that's what it is. And so I think in general, if you can, in a structured and supportive way, help people bring to consciousness, face some of these very unpleasant experiences and come to terms with them, that is intrinsically therapeutic. And I think a lot of what it is, both with hypnosis and with the EMDR, is the element of control. If you think about it, why doesn't PTSD cure itself? Because after all, flashbacks are reliving the traumatic event. So why isn't that a kind of exposure therapy? I think it isn't, because it's uncontrolled. You feel attacked by the flashback, by the memory. And with both hypnosis and EMDR, you're with a supportive person who's trying to help you with it, and you're summoning the memories. They're not attacking you. and you're trying to put them into perspective. So I think that component of control is what's very different about the therapeutic use of these memories and just natural flashbacks where you feel reattacked by the memory the way you were by whoever or whatever attacked you.
This whole idea of what you're doing is you're essentially developing a coherent narrative around the event, and you're gradually making sense of what happened, and that maybe increases your sense of control and
Yes.
helps you to move on. Maybe there's a similar kind of mechanism at work there.
It does, Niall. You're absolutely, it's well put, but there's another component to it, and that is it's the sense that people would rather in general feel guilty than helpless. The essence of trauma isn't fear and it isn't pain. It's loss of agency. It's that you're made into an object. Your body becomes an object and you don't control it. And we hate that. And so people often blame themselves. They say, well, if I only hadn't gone to the drugstore at 4 PM, this guy wouldn't have grabbed me in the park. And then, whereas how could you know? You were victimized. And so I think part of what is therapeutic, what is helpful, is helping people face and accept the fact that for a period of time, they had no control over what happened to their body. It's a terrible thing, but it relieves them of inappropriate guilt. I saw a woman recently who came from a country that is now famous for mistreating women. And it turned out that, and she got out, came to the United States. She had been raped by her landlord when she was 12 years old. Her family was afraid to do anything about it because they were afraid of being thrown out of the apartment. And she said, I grew up on the streets of my country. My body wasn't my own. Men would feel free to do or say anything they wanted to. I hated it. She got here, she became a healthcare professional, but she was always kind of chronically depressed and miserable. And she came to see me, and I used hypnosis to go back to the day when she was raped. And I said, I want you to picture yourself as if you were your own mother. Picture yourself as a little girl after you were raped. And she started to cry. And I said, I want to ask you a question. Was this your fault? And she said, I'm stroking her hair. I'm stroking her hair. She's a sweet little girl. It's not her fault. And it was very moving. And she sort of saw herself in a different way. She'd always been sort of blamed that somehow, she let it happen or invited it or something. And that's the case with most rape victims. They're blamed for something they didn't control. And she called me about a week later. And she said, Dr. Spiegel, my psychiatrist wants to know what you did to me. She said, because I'm not depressed anymore. And she said, my friends don't recognize me, So sometimes you can get to the sort of crux of what it is, the burden that people are left with. And it's not just the bad event, it's their interpretation of the bad event. And if you can help change that, and that's what I meant earlier when I said that you're sort of treating from the bottom up. You're disconnecting people from their usual way of thinking about the problem they've got. And that's a fertile opportunity for inserting a different and more helpful point of view.
That's fascinating. And it's just incredible that you're able to have that kind of effect in somebody's life, and it just speaks to the power of this approach. Something I'm curious to ask Dr. Spiegel is, how do you apply hypnosis in your own life?
I've used it on and off for years. I had recurrent dislocation of my shoulder years ago when I was younger, and it was getting worse and worse, and I decided I needed surgery. And so I had an operation. I used general anesthesia for that. It was a 3-hour procedure. They rebuilt the glenoid fossa there in the cup, but I came out of it. And I wasn't using any of the pain meds they were giving me. I was just imagining my shoulder was, cool, tingling, and numb. I filtered the hurt out of the pain. The movement discomfort didn't bother me because I knew the shoulder was getting better and was going to be a lot better than it had been before. And I went one day, I was at Mass General. I worked there so I could get access to my record. And the surgical resident wrote, patient using very little pain medication, we mustn't have cut many nerves. That's the only way they could understand it. And I'm here to tell you, I got a scar from here to here on my shoulder. They cut nerves, And I used it once I was trying to water ski, and I was not naturally very good at it. And I did the rookie mistake that most people make, which was that I was bending my arms to kind of control the pull of the rope and keeping my legs stiff, which is a perfect formula for winding up face down in the water, you know. And so I hypnotized myself and just said over and over again, arms straight, knees bent, arms straight, knees bent. And I was water skiing. You know, I just kind of programmed my body to do what it should do and not let my anxiety about it get in the way. So I've used it for pain control. I arrived after a sleepless night on an airplane in London and had a horrible headache. And I, you know, used my few shillings to try and, you know, get aspirin out of a dispenser, and it swallowed the shillings and didn't give it to me. And so I'm bouncing on the bus into the city feeling terrible. And I said to myself, you idiot, you do this for a living, do some self-hypnosis. And I was about as surprised as you were about sleep when within 5 minutes, my headache was gone, you know. So I use it for stuff like that. And I've used it. My wife, Helen, she's a stem cell biology professor at Stanford, gave birth to both of our children with hypnosis as the sole anesthesia. She didn't have an epidural. She wanted to be in control of the delivery, and she was. And our son, Dan, who's now a very large guy and an architect, was 10 pounds when he was born. And she would say to me during about the 8-hour labor, oh, you know, I'm not quite floating in Lake Tahoe right now. And I said to her, you keep floating, just keep floating. She said, I'm a doctor. There are drugs for this. I said, keep floating in the lake. And she got through it fine, and I had no pain at all. It was, we've used it in our lives.
Incredible. Now, just going back to the pain aspect there, you know, we're having a massive opioid crisis because of pain medication. I'm just wondering what your thoughts are on hypnosis as a potential replacement for pain medication, and what kind of effect that could have as well.
Well, it is drastically, tragically underutilized, Niall. You know, in the last 10 years in the United States, we've had 300,000 opioid overdose deaths that aren't necessary, should not have happened. You know, opioids have their place. They're, you know, particularly useful for acute pain. There was a paper, I think, out of Australia just came out showing that the use of opioids for chronic pain is no better than placebo, but it's a hell of a lot more dangerous, a hell of a lot, you know, because the mu-opioid receptors that suppress respiration are different receptors than the ones for pain and also pleasure. And so what can happen is people get habituated to the fact that they're needing a higher dose of the drug for pain, and they think, well, I can tolerate more because I'm not getting the pain effect. But what they're doing is overstimulating the receptors that suppress respiration. So they go to sleep and they don't wake up. That's what happened to the musician Prince, who, you know, was using it for pain. And it's tragic and unnecessary. And we have patients, I'll tell you now, one reason that I built Reveri and that I want people to have access to this is we published a study in The Lancet, you know, a leading medical journal, in 2000. It was a randomized clinical trial, 241 patients randomized to one of three conditions. They were all having arterial cut downs and catheters inserted into their femoral artery to chemoembolized tumors in the liver or visualized renal artery stenosis. Takes about 2.5 hours. You don't use general anesthesia for it, but it's painful and very anxiety provoking. So the randomization involved a third of the patients getting just the usual treatment as usual, which was opioids. Press a button, you get opioids delivered into your artery. The second condition was that plus a friendly nurse comforting you. And the third condition was that plus a psychologist trained to help people do self-hypnosis. Imagine you're floating in a bath, like a hot tub, cool tingling numbness, filter the hurt out of the pain. So after an hour and a half, it's about a 2.5 hour procedure. The standard care patients had pain ratings of 5 out of 10. The friendly nurse patients had a pain rating of 3 out of 10. The hypnosis group had a pain rating of 1 out of 10, and they were using half as much opioids as the standard care group. We looked at their anxiety. Anxiety for the standard care group was 5 out of 10, 3 out of 10 for the nurse 0 out of 10 for the hypnosis group. I was afraid they'd all died or something. They were fine. Their procedures got done on average 17 minutes quicker. So it actually saved $348 a procedure, just getting them through the system quicker. They had far fewer complications, cardiac blood pressure abnormalities, far fewer in the hypnosis group. So they had far less pain, no anxiety. They got done quicker and had fewer complications. Now, Niall, and we published this in the Lancet, if a drug did that, if what we used was a drug instead of hypnosis, every hospital in the US and Canada would be using it, right? But no, it was hypnosis. So did people take it seriously? No. So that's why I built Reveri. I'm saying, look, I understand that, and I teach people to do it. I love it when people learn. It's not that hard to teach patients to do it. But you know what? If patients can learn to do it for themselves, that's even easier, because the most motivated person is the patient. And if they learn to do it, they've got it. And so I want people to have access to and use Reveri to control their pain, to control their stress, to control their habits, because it can be a tremendous hamburger helper to our medical profession and people who care for others, to have the patients know themselves how to mobilize and utilize this terrific resource.
You were recruited by Irvin Yalom to work with him in some of his studies.
Yes.
What did you learn from Dr. Yalom and the work you guys did together?
Thank you for asking. Irv is a dear friend. He's 92. I'm going to go over and have a drink with him later today, actually. He was the guru of group psychotherapy. He helped to recruit me to Stanford a long time ago. And he invited me to join him. He called me up one day in my first year at Stanford and says, "Hey, David, I'm co-leading a group of women dying of breast cancer. Would you like to co-lead it with me?" And when the world's authority on group therapy invites you to join him, you think for a second and a half and say yes. And so I learned from watching him. He's incredibly adroit in managing groups. And his big focus is on the here and now. Don't speculate about things outside. Look at what's going on in the group and help people face and deal with issues that are troubling them. I taught them self-hypnosis, just like the kind that we have in Reveri now at the end of each group, to deal with their pain and fear. We did a randomized clinical trial of that, and found that at the end of the year, the women in the support group had half the pain the women in the control group did on the same and very low amounts of pain medication, just by in hypnosis, filter the hurt out of the pain, float with the pain. Imagine you're somewhere else, leave your body here and go somewhere else. Use your brain to reprocess the pain signals and make them less damaging. But we also, his here and now approach taught me, we had one woman who was getting sicker, but everybody admired her because she was always immaculately dressed, matching accessories, makeup, hair done just right, even though she was clearly getting sicker. And she said to the group one day, my husband he's a banker, but he's not a teller. He doesn't talk. And I think he's had enough of me, and maybe it'd be better if I just went away, if I just ended my life. And that worried me. It worried everybody in the group. And we could have focused on what her husband was like, But instead I said, well, I think she's asking us a question. Are we tired of her? Would we rather see her go? And she got powerful feedback about how much they wanted her to be there as long as she could, how much they admired her kind of putting on her best face and dealing with it as well as she could. And she did not shorten her life. She died about 4 months later. And in her will, she had a provision that all the members of the group would be met by a limousine that would take them from where the group met to where her memorial service was, and we spoke about her. So I learned from Irv how to use the interaction in group to its maximum. And we found that people, became experts in living with cancer. They felt good about the fact that they could provide advice and help to one another. So it was using their cancer experience, but not being ashamed of it, not hiding it, but using it as an asset, something they could use to help other people deal with their problems. So they came to feel like experts in living. They were able to face mortality. One woman said being in the group is like looking into the Grand Canyon when you're afraid of heights. You know, if you fell down, it would be a disaster, but you feel better about yourself because you can look at it. I can't say I feel serene, but I can look at it. And so that was a powerful lesson for me and for them. We found in a randomized trial that we helped these people suppress their emotions less and feel better. They were less anxious and depressed, not more. This was at a time when we were told we'd demoralize patients because they'd see one another die of cancer as though it's a novel idea to a cancer patient, but they felt better, not worse. And we found not only was their mood better and their pain better, but in our first randomized trial, the women randomized to the support group lived 18 months longer than the control patients.
Wow.
Now, they eventually all died of breast cancer, but they lived longer. We published that in The Lancet in 1989. And it was one of the first studies to raise the question of whether strong emotional support can help people not only live better, but live longer.
Sort of reminds me of, I did a skydive in California once, and you know, you're on the plane, and you're just glad there's other people on that plane with you, because if you're doing that by yourself, it would be about 100 times scarier, you know.
That's a good point. There are other people here who are just as crazy as I am, and they're going to do it. That's it.
Let's maybe talk now about the brain and what's going on in the brain during a hypnotic state. And also, if we could maybe link this with addiction treatment and why it, you know, how these brain mechanisms might help to explain why hypnosis can be an effective treatment for addiction.
Sure. Well, we've done functional and magnetic resonance imaging studies and EEG studies on people in hypnosis, and we find some very interesting things that kind of make sense. The first thing is, when you go into a hypnotic state, you reduce activity in the dorsal anterior cingulate cortex. That's part of what we call the salience network. It's a pattern matching part of the brain that alerts you to potential trouble. So if you suddenly hear a loud noise and you think, oh, I better see what that is, that's your DACC lighting up and saying, hey, wait a minute, stop doing what you're doing and pay attention to this. It's a part of the brain that social media often trigger when they, you know, send you a message about some potential threat or some negative evaluation by somebody else. Your brain tends to shift from what you were doing and go to that. In hypnosis, you turn down activity. So you're coordinating activity, in fact, between that region and the executive control network, the dorsal lateral prefrontal cortex. And so you're allowing yourself to focus on something by turning down the system that would normally distract you and have you potentially do something else. We find that there's also more functional connectivity between the dorsolateral prefrontal cortex and the insula. The insula is part also of the salience network, part of the pain network. It's a mind-body conduit. So you enhance your functional connectivity to be able to control your body, but also to get signals from your body. We call that interoception. So in hypnosis, you're in a heightened state of connectivity with your body. The third thing it does is it provides inverse functional connectivity. So when one region's up, the other is down. With the posterior cingulate cortex, that's part of what we call the default mode network. It's a part of the brain that's active when you're not doing anything much, but you're ruminating about yourself and who you are. So you can get fully engaged in something without worrying about, what does it mean that I'm doing this? I don't usually do stuff like that. Now, that's the part that stage hypnotists exploit when they have the football coach dance like a ballerina. You know, you're not thinking about, why would I do this, especially in public? I don't do things like this. So, but it really is also, more importantly and less theatrically related to cognitive flexibility. You can try out different things and see what it's like. And so what you can also do in hypnosis, and what ours and other research has shown, is that you can regulate pain and therefore potentially pleasure too, by turning down activity in parts of the brain that tell you whether something matters or not. So there's been studies from University of Montreal, Pierre Rainville and his colleagues, showing that one thing that happens in hypnotic analgesia is you can turn down activity in the anterior cingulate cortex. So it's a part of the brain that tells you whether you should worry about something or not. If you turn down activity there, you're less worried about the pain. It just doesn't bother you as much. So I think one of the things that happens in hypnosis is you have extra control over your reward and punishment system. And so it means that you can be more flexible about what rewards you and less worried about things that cause you discomfort. And so I think hypnosis can literally make you feel better, even at times where you're feeling restless or have urges to take a drug you're addicted to. And instead, you can say, I'm going to focus on respecting and protecting my body. I'm not going to let even withdrawal symptoms worry me or bother me as much. You know, many people kind of give up control when they start to feel jumpy or restless or irritable because they're starting to have withdrawal from a drug. Most of the time, it's not going to kill you. The drug will kill you, but the withdrawal won't. And you can, if you can get yourself through a time of feeling physically restless by focusing on things that make you feel good, on going somewhere else in your imagination so that you're not so worried about the feelings in your body. They're real, but they don't have to be determinative. And hypnosis is a state where you can identify how your body's feeling and even regulate it, control it, help people manage the way their body functions.
With regards to addiction, this is particularly interesting. You know, your colleague who you've interviewed with, Andrew Huberman, he talks about addiction potentially being a progressive narrowing of what you can get pleasure from. And what point. The cognitive flexibility element here is that you're maybe able to, it puts enough flexibility in the system where that you can switch what you're going to get your dopamine from to something that is actually going to be beneficial for you, as opposed to just the substance itself. So you can switch that orientation slightly. Is that
I think that's a very astute observation. Huberman is terrific, and I think he's right about the narrowing. But you know, think about the narrowing of attention in hypnosis and the dissociation. You can handle that differently, because many people, you know, I mentioned interoception before, take these feelings that you can only get pleasure from the drug, or that the discomfort you get from reducing or eliminating the drug is something you have to suffer with. And it's like pain. It's unpleasant, but you can learn to focus on other things. You know, the problem is people are intimidated by the message the drug is giving them through their body, which is saying, I'm taking over here, and the only way you're not going to be miserable is if you get more of me. And instead you can say, well, yeah, it's uncomfortable, but I've been through discomfort before. I can manage the discomfort. I can focus on other things. I'm not going to let it teach me what I have to do and what I can't do. And so I want people to use techniques like hypnosis to refocus on their commitment to respect and protect their body, rather than on being intimidated by a drug that's acting like a bully. It's saying, you know, if you don't pay me, you're in trouble. Well, you don't have to take that. You can actually alter your perception of and your experience of pleasure and discomfort with techniques like hypnosis.
Are you aware of any research on the benefits of hypnosis for addiction or substance use disorder compared with other forms of treatment?
The research that I know the best is with smoking, and nicotine is an addicting substance. And there is plenty of research that shows that hypnosis can be quite helpful. We found that a single session of teaching people self-hypnosis can result in about half stopping initially and 23% not touching a cigarette in 2 years. And we found that with the Reveri app alone, that was face-to-face hypnosis, Reveri app alone, 19% will stop smoking. And that's, you know, that's not bad. That's as good as varenicline or bupropion. It indicates that people can indeed learn to master that. I had one wonderful subject in one of our early studies using Reveri who came in because she was curious about it. She said, I'd smoked for 25 years and I didn't even want to stop, to tell you the truth. But I thought, what the hell? And she tried it once and she didn't like it. But that night she went home and tried it again. And she lit up and the Reveri instruction is, think about this: for my body, smoking's a poison. I need my body to live. I owe my body respect and protection. You focus on respecting and protecting your body. Would you put tar and nicotine into the lungs of your baby or your pet dog? No. So give your body the same respect you'd give a child or a pet. And she said, I lit up a cigarette. I looked at it. I went, feh. who needs this? I put it out. I haven't had a cigarette since. My friends can't believe it because they knew what a smoker I was. I'm helping my friends to stop smoking now. And she said to me, this is some kind of crazy ass voodoo shit. She said, and I mean that in a good way. So people can surprise themselves just the way you surprised yourself when you fell asleep. And that's what I find so exciting and cool about hypnosis and reverie, that you can discover something within yourself that you didn't even know you had, but it's a real skill and ability that you can use to counter and restructure the things that are blocking you by focusing on what you're for and how you can respect and protect your body.
This is something that's really, I suppose, hitting home for me, is the value or the emphasis of focusing on what you're for as opposed to what you're trying to move away from. That seems to be absolutely essential here. And I noticed on the app that there's a hypnosis for eating. And I'm just curious about do you have any examples? I think I've heard you speak about a friend who used it for eating who wasn't even hypnotizable. Is that right? And it worked?
Yeah, yes.
And
the idea there is to focus on, thinking of feeding your body. It's funny that we don't think about this way. Like with smoking, you think, well, I'm doing it to myself. And I hear my patients say that even after the hypnosis, and I say, no, stop. You're not doing it to yourself. You're doing it to your body. Your body is paying the price. And because if you think you're doing it to yourself, well, I could stop anytime and it's fine, but it may be too late for your body. And so if you don't take care of your body, it will pay a price and then you will. So if you want to do what you want to do with your life, you've got to treat it in a certain way that it can enable you to do it. You wouldn't expect your car to drive you very far if you put sugar in the gas tank. In the same way, you can't expect your body to take you very far if you keep putting poison, tar, and nicotine in its lungs. In the same way with food, and this person, the focus was on learning to eat like a gourmet, to recognize that you can enjoy eating more even if you eat differently, if you eat less, if you're trying to lose weight. And you can focus, therefore, on the way gourmets look at the temperature, the flavor, the texture, the aroma of the food, savor every bite, and enjoy it, enhance your enjoyment while you eat a diet that is not overly loaded with processed carbs. Avoid processed food, eat fresh fruits and vegetables and protein, and find that you're restructuring your whole approach to eating. And you're putting as much care into the way you feed your body as you would to how you feed your baby or your pet. So you can enjoy eating more while you're eating a much better diet.
that's interesting. I never thought about, creating that differentiation between, you're not saying, like, whenever you create that separation, saying that this is affecting my body, not myself, it actually can help to make the change.
Yes, yes. It puts you in a mode of respect and protection, not of deprivation.
Sort of like a parent looking after the...
Yes, exactly, exactly right.
What might a typical hypnosis session look like? Let's say I was to come to you for a hypnosis session. What would that look like in practice? And is there anything you do beforehand to get someone ready for it?
Well, I explain what it is. I measure their hypnotizability. And one of the cool things on the Reveri app, and I hope people will go try it out. The website is www.reveri.com, and you can download the app from the App Store if you have an iOS phone, or from Google Play if you have an Android. You can test your hypnotizability. So what I do before I use it therapeutically in my practice is I just do a kind of neutral hypnotic experience. So I tell them their hand will feel light and buoyant and float up in the air like a balloon. If you pull it down, it'll float right back up. And then we see if that happens, if it works. And for the majority of people, it does. For a few that it doesn't. And we can score you on a 0 to 10 scale for how hypnotizable you are. And if you are hypnotizable, we go ahead and use hypnosis. And that's the case for most people. For a few, they're not, and I just make it more of an explanation. And there are other ways we have of helping people relax if they're not hypnotizable. We can use progressive muscle relaxation, where you tense muscles and then release them in various parts of your body. We're also now using for everybody a technique we call cyclic sighing, which helps people relax. So you inhale halfway, hold your breath, then fill your lungs completely, And you can try it if you want, and then slowly exhale through your mouth. So inhale halfway through your nose, hold, fill your lungs completely, and then exhale slowly through your mouth. One more time, inhale through your nose halfway, hold, fill your lungs, and then exhale through your mouth. And tell me if you feel anything in your body as you do that now.
Just feel very relaxed.
Yeah, it's very quick. I'm glad you noticed that right away. So we can help everybody feel somewhat relaxed. So teaching people how to self-control just their level of body arousal is good. So then I would put them into a hypnotic state very quickly. It doesn't take long. You know, people used to spend 15, 20 minutes counting upstairs and downstairs. It's unnecessary. If you've got the ability, you can go to it right away. So I have people look up, close their eyes, take a deep breath, let the breath out, slowly let their body float. Imagine you're floating in a bath, a lake, a hot tub, or floating in space, and then let one hand or the other float up in the air like a balloon. That's your signal to yourself and to me that you're ready to concentrate. And then I'll present them with the exercise. It might be, imagine the part of your body that hurts is either in a warm bath or receiving an ice pack. Filter the hurt out of the pain, or focus on protecting your body from the poison of opioids or cocaine or whatever it is you're using. Think about the effect not on you, but on your body. And think about how much better you feel if you can respect and protect your body. Notice how good you feel when you do that. Picture yourself playing with your kids in a way that is more open and free because your body is free to help you do it. Let your body float. And then when you're ready, bring yourself out by counting backwards from 3 to 1. 3, get ready. 2, with your eyelids closed, roll up your eyes. 1, open. Let your hand float back down, make a fist open, and that's the end of the exercise. Use this exercise every 1 to 2 hours. Anytime you have an urge to take the drug, don't fight it, admit it, but sit down or lie down, go into the state of self-hypnosis, and reassert your commitment to respect and protect your body.
What about intermittent positive reinforcement as a strategy in clinical work?
An excellent point, Niall. The best way to change behavior, and this is like, again, focusing on what you're for, not what you're against. The best way to change behavior is intermittent positive reinforcement. We had a staff meeting at a time when the hospital was trying to get everybody to use disinfectant on their hands when they walked into a patient's room. And they were saying, tell the nurse to, if they see somebody walking in the room without doing it, to take the doctor aside and bawl them out for not doing it. And I said, all that's going to do is create worse feelings between the doctor and the nurse. Don't do it. If instead you ask the nurses to go up when they see a doctor going into the room and putting disinfectant on his hands, thank you for doing that, doctor. I really appreciate it. You will see a lot more doctors taking care of their hands when they go into the room. So you change behavior, again, by focusing on what you're for and receiving positive reinforcement for it. One of the things that traps people in addiction is that they just feel bad. You know, they look at their family and they think of all the ways they've hurt them or let them down or disappointed them. They feel their body getting uncomfortable and they think my body's only going to get worse. It's all negativity. And find something you can feel good about. You know what? What I can feel good about is I'm protecting my body from ingesting a poison that I know is harming it. And I'm protecting my family. I can now feel freer to engage with them, to play with my kids, to take my wife out to dinner, to do things that make them feel good and make me feel good. So you can affiliate with a part of yourself that wants to do better and do it. That's intermittent positive reinforcement. And that's the most powerful way of changing behavior.
What about going back? Let's say that we've had memories from a young age that we can't access. Is hypnosis a potential vehicle for accessing those memories?
It is. It is not a truth serum. You know, the fact that you remember something doesn't mean that it happened just the way you remember it. If you don't remember it, it doesn't mean it didn't happen. But I have certainly had experiences with people who remembered things that they previously didn't, and it helped to change their lives. It helped them to put into perspective things that previously they had been unaware of. And So I had a Vietnam vet who wound up discharged from the military for psychiatric reasons. He spent 6 months in a jail because he had some LSD and got rounded up in a drug raid with a bunch of people who had heroin. And there was a note from the social worker saying, this guy is not your typical person who deserves to be in jail. And it turned out that he had had a dissociative episode when he had informally adopted a child, a Vietnamese orphan, as kind of his son. He was the youngest of 15 kids in a family, and he sort of adopted the kid. And one day he came back to his base and found that the kid had been killed in an attack. And so I had him relive that moment. He recalled running off into the jungle and just going crazy for a few days. And then I had him go to the boy's funeral and picture the death. And he held his hand up and said, ashes to ashes and dust to dust, I guess. That's all I can say. And he said, he blamed himself. He said, if I had only taken you to the hooch, you wouldn't be there, man. It's all my fault. It's all my fault. And he had no way of knowing that would happen. And I said, I want you to picture now sometime when you were really happy with him. And he then recalled a birthday party he had arranged. And his family had sent a model train for the kid. And he said, and he starts laughing. He changed his affect right away. And he said, you never seen a train before, right? And boy, you're happy. And they gave him a cake and all this. So he came out of the hypnosis, and all he remembered, he said, was a grave and a cake. Grave and a cake.
Wow.
And he felt different. And he was now out of jail, and we got him out of the psychiatric hospital. And he wound up teaching kids how to do long-range bicycle trips, and wound up putting into perspective something that he didn't even understand and couldn't explain to people, why he had just lost it in Vietnam.
Wow, that's unbelievable. Now, what role do you see self-hypnosis and Reveri potentially playing in the future of addiction treatment? What kind of effect could that have?
Well, my hope is that it will be a tool that people and professionals can use to help people deal with the real discomfort that people feel when they're trying to kick addictions. But it's something they can reach for, use whenever they want. It's there 24/7, wherever your phone is, we're there, to help people get through times when they're physically in pain or uncomfortable, having withdrawal symptoms, when they're trying to make that choice. Do I, change who I am and how I am with my family, or do I just go back to doing the same old thing that's been dragging me down? That it's one more tool people have to help address their pain and distress and decision-making process when they're trying to kick it and live a different life. And if you can use your imagination to picture yourself being someone different, if you cannot feel you drag things down so far that there's no up anymore, but say, I can see that, I can face it, but I want to be a better person to my family and my friends, and I want to be a better protector of my own body. You can visualize yourself being different. You can start to be different, to act different. You can handle the discomfort of withdrawal and see it from the point of view of something that should not determine who you are and how you protect and respect your body.
You do a lot of interviews, Dr. Spiegel. I'm just curious to ask, is there anything that you don't get asked that you wish you would get asked about more often?
Well, I guess I would like to be, I mentioned at the beginning of the interview, Niall, that hypnosis is the oldest Western conception of a psychotherapy. It is. But I want people to think of it as the newest thing too, and in particular, linking its use to the power of dissemination that we have now with apps and smartphones and the internet, that it can be one of the newest things that we can couple what we've learned about what is therapeutic and how to approach managing even very difficult problems with technology that means it's there anytime you want it, anytime you need it. And so it's the oldest, but in some ways, I hope it's the newest. I admire the way Headspace and Calm have made meditation available to millions and millions of people around the world. And that's what I want for Hypnosis with Reveri. I want it to be available everywhere for people to use it, take advantage of it, get the benefit of their own inner ability to take a new point of view about an old problem, relate better to their bodies and then to their friends and families and others. I think there's tremendous power that hasn't been unleashed, and that modern technology enables us to spread much more widely than we've ever been able to do before.
I've heard you say things like you thought about transformation, as in like the word transformation, like things like that.
Yes.
Any more ideas in that area?
Well, we've tried. It's, when I do it, everybody knows it's hypnosis. People have used terms like neurohypnology or something like that. We do need a new name, but that's why you'll notice we call Reveri and not something with hypnosis in the title. It's Reverie is a kind of a dream. It's going into an altered mental state and dreaming about something that usually is positive. You have a reverie about things that make you feel good, or have reverie about people who you admire and respect, or things you've done that made you feel good or made other people feel good. So Reverie is an attempt to do that. I mean, we say we're a hypnosis app, we are, but the first word people have to sign on with is reverie. And so my dream is that people can use their own reverie to make their lives and the lives of their loved ones a hell of a lot better.
The one that just sprung to my mind there as we're talking about this is maybe something along the lines of like assisted neuroplasticity, or I don't know, self-assisted neuroplasticity. You probably think that's nonsense, but it jumped to mind. I thought I would share that.
It's a good idea, and I think you're right. And there's a neuroplasticity part of this. It's part of what people are talking about what Michael Pollan writes about, and how to change your mind. I think there is neuroplasticity involved. I think we underestimate our powers to change our mind and change our brains. And the more you use new pathways in your brain, the stronger they get. And so just finding a way to turn off the old noise and turn on the new good news is something you can do with hypnosis. And I hope people will do it with Reverie.
If you could get a letter to everybody in the world currently struggling with an addiction, and you could include just a few key points, what might you say in that letter?
I would say, don't let the drug or the alcohol or whatever it is be the boss of who you are. You take back control and you set your own priorities. And you're struggling with a problem. There's no question about it. Drugs are like a bully that's pushing you around. And if you let yourself get pushed around, you will be. And I'm not pretending that it isn't a struggle. It is. But take it a day at a time. Get the kind of support you can from your friends and family, and determine to be the best keeper of your own body you can be, and the best protector of it, and the best friend to your friends, and the best family member to your family. But take the threat of the drug seriously, but don't let it take you over. And use this state to start envisioning and feeling that you can be different. Use Reverie, use neuroplasticity, use your brain to envision how you can be a better minder of your own body, and that you have the ability to determine what goes into it and what doesn't. No matter how hard it is at times, no matter how impossible it seems, if you get into this altered state where you start just imagining, what would it be like if I kicked this stuff? What would it be like if I were not putting OxyContin into my body, or amphetamine, or cocaine, or alcohol? Picture yourself being a person liberated from that, and how well your body will feel and how well you will feel. You can do that. It's a mental exercise that can lead you in the right direction.
It goes back to the theme of focusing on what you're for.
That's exactly right. That's exactly right.
For people that are curious about trying out the app, Reveri app, where's the best place to go online to get it and try it out? And
you can you can learn about it by going to www.reveri.com. And there's a description of the app and links to go to the App Store or Google Play to download the app to your smartphone and start using it. And there's also descriptions of the research behind it and answer questions about what people want to know about it. The first week is free, and Reveri costs a whole lot less than a lot of the other things we spend money on. So you can subscribe monthly or yearly or get a lifetime subscription, all for very reasonable amounts. And I hope lots of your listeners will do it.
Brilliant, Dr. Spiegel. Well, thank you so much. I want to wish you the best on your mission going forward.
Thank you, Niall.
This, for me, if this could get into the hands of as many people that Headspace and Calm and that have got into, it would create such a positive tidal wave in human culture. So I think it's massively important work, and just keep doing what you're doing, and hopefully just more and more people will adopt this and start using it.
I sure hope so. Thank you. I really appreciate that. And I appreciate you giving me the opportunity to talk about it today. That's great.